One of the most common questions I hear is, do I need a rhinoplasty or can I just do a non-surgical nose job? Both are real options, but they're designed for very different goals. So today, let's break down who each one is for and how to decide what actually makes sense for your nose. The nose is one of the most central features of the face. Even small changes can make a big difference in balance and confidence. That's why it's easy to feel overwhelmed when you hear terms like rhinoplasty and liquid nose job. The key is understanding what each option can and cannot do. A non-surgical nose job typically uses dermal filler to reshape the nose without incisions. It can help with smoothing a very small bump, creating the illusion of a straighter bridge, lifting a slightly droopy nasal tip, although this is unpredictable, and improving symmetry in mild cases. It works by adding volume strategically, which can visually improve the contour. But here's the important limitation. A non-surgical nose job does not make the nose smaller. It cannot fix breathing issues, and it cannot correct structural problems. It's best for patients who want temporary, subtle refinement and understand that results typically last about 9 to 18 months. Who is a good candidate for a non-surgical option? This option is typically best for patients who want to quote-unquote test drive a change, have very mild cosmetic concerns, are not ready for surgery, and want minimal downtime. When done conservatively and thoughtfully, non-surgical rhinoplasty can be a nice option, but it requires precise technique and restraint. Surgical rhinoplasty allows us to reshape the underlying structure of the nose. That means it can reduce the overall size, correct bumps at their source, refine the nasal tip, straighten a crooked nose, and improve breathing and airflow. This approach does not rely on illusion. It creates true structural change. Because of that, surgical rhinoplasty offers permanent results and far more control over form and function. Now, who is a good candidate for surgical rhinoplasty? Rhinoplasty may be the better option if your nose feels too large for your face, you have breathing issues, your nose is crooked or asymmetrical, or previous filler treatments have reached their limit, or you want a long-term solution. It's also important to understand that rhinoplasty isn't about perfection, it's about balance. The goal is to create a nose that fits naturally with the rest of your facial features. I often explain it this way. A non-surgical nose job is like adjusting the lighting to improve how something looks. Rhinoplasty is like remodeling the structure itself. Both can be useful, but they're not interchangeable. My approach is always individualized. I don't recommend fillers when surgery is clearly the better option, and I don't recommend surgery when a small, non-surgical adjustment will meet someone's goals. The most important part of this process is honesty about anatomy, expectations, and long-term outcomes. If you've been trying to decide between a rhinoplasty and a non-surgical nose job, I hope this helped clarify the differences. Drop any questions in the comments below, like and subscribe for more videos, and visit my website to book a consultation. See you in the next one.